Hello friends, have you ever wondered why vitamins D3 and K2 are not just supplements but true superheroes for your health? Today I'm going to tell you how these two vitamins can transform your well-being and strengthen your bones, as well as protect your heart. This video will not only help you better understand their role, but also teach you how to properly utilize them in your diet. Be sure to watch this video to the end because I'll share not only scientific facts, but also secrets that you won't find in other sources. And at the end, there's a gift waiting for you. A simple and actionable tip for adding these vitamins to your daily regimen. Don't forget to subscribe to the channel so you don't miss even more helpful videos on how to improve your health and make every day better. Vitamins D, 3 and K2. A detailed breakdown and tips for use. Vitamins D, 3 and K2 are two vital nutrients that are key to bone health, heart health, and overall well-being. However, in today's world, many people do not get enough of them from food or sunlight. Combining these vitamins in the right proportions can greatly benefit your body, improving your quality of life and reducing the risks of various diseases. 1. Vitamin D3. Why do I need it? What is vitamin D3? Vitamin D3, or cholecalciferol, is a fat-soluble vitamin that is synthesized in the skin when exposed to sunlight. However, for most people, sunlight is not an adequate source of vitamin D, especially during winter or in regions with low sunlight exposure. It plays an important role in regulating calcium and phosphorus metabolism, which is critical for maintaining healthy bones and teeth. The main functions of vitamin D3 are bone strengthening. D3 promotes calcium absorption in the intestine, which is essential for normal bone growth and strength. Immune system support. It helps the body fight viruses and bacteria. Mood management. Recent studies suggest that vitamin D deficiency may be linked to depression and cognitive decline. Preventing osteoporosis. D3 plays a key role in preventing bone diseases such as osteoporosis. Vitamin D3 deficiency. Deficiency symptoms may include fatigue, weakness, bone and muscle pain, and a higher risk of developing infectious diseases. In children, vitamin D3 deficiency can lead to rickets, and in adults, osteomalacia, softness of the bones. How to get vitamin D3? Natural sources: sunlight, 10 to 30 minutes a day; fatty fish, salmon, mackerel, sardines, egg yolks, dairy products enriched with vitamin D. Problems: modern lifestyle, when we spend a lot of time indoors, as well as the use of sunscreen, significantly limit the production of vitamin D in the body. 2. Vitamin K. 2. The secret to bone and heart health. What is vitamin K2? Vitamin K2 is a form of vitamin K that is essential for the proper distribution of calcium in the body. Unlike vitamin K1, which is involved in the blood clotting process, vitamin K2 activates certain proteins responsible for the directed distribution of calcium, thereby preventing its accumulation in soft tissues and blood vessels. The main functions of vitamin K2 are directing calcium into bone. Vitamin K2 activates osteocalcin, a protein that helps calcium to be deposited in bone tissue. Vascular health. It prevents calcification of arteries, reducing the risk of cardiovascular disease. Tooth and joint support. K2 also helps mineralize teeth and improve joint health. Vitamin K2 deficiency. Recent studies have shown that vitamin K2 deficiency may be associated with a higher risk of osteoporosis, cardiovascular disease, and even cancer. People with K2 deficiency may experience increased bone fragility and joint problems. How to get vitamin K2? Natural sources. Fermented foods. Natto, Japanese fermented soybeans, sauerkraut, cheeses, meat from animals that have been grass-fed, beef, chicken. Foods rich in vitamin K2 are not widely available in the regular diet, so many people may be deficient. 3. The importance of combining vitamins D3 and K2. Why do they work better together? When we take vitamin D3, it increases calcium levels in the blood, which is important for bone health. However, without vitamin K2, calcium can be deposited in soft tissues and arteries, which can lead to calcification. Vitamin K2 directs calcium to the bones and teeth where it is needed and prevents calcium from building up in the arteries, improving cardiovascular health. Risk of misuse. When vitamin K2 is deficient, high levels of calcium supported by vitamin D3 can lead to the formation of calcificates in the blood vessels and kidneys, increasing the risk of cardiovascular disease. Co-administration of these vitamins reduces the risk of osteoporosis and improves bone health, protects blood vessels from calcification, reducing the risks of heart attack and stroke, promotes better absorption of calcium and other minerals. 4. How to choose supplements and take them correctly. What to look for when choosing supplements. Vitamin forms. It is best to choose supplements with vitamin D3, cholecalciferol, and vitamin K2 in the MK7 form, as these forms are more bioavailable to the body. Dosage. The recommended daily dose of vitamin D3 is 2,000 to 4,000 international units per day. For vitamin K2, 100 to 200 micrograms. Food intake. Both vitamins are fat-soluble, so for better absorption, it is recommended to take them with foods containing fat. When to take supplements. If you don't have enough vitamins D3 and K2 in your diet, or if you live in a region with limited sunlight. People over the age of 50 and those who don't get enough fermented foods and animal products benefit from taking supplements. 5. Popular questions and myths. Myth 1. I can get enough vitamin D from food. It's actually very difficult to achieve the necessary dose through food alone, especially if you don't eat oily fish or unfortified foods. Myth 2. If I take vitamin D, I don't need to take care of vitamin K2. This is a dangerous misconception. Without vitamin K2, calcium can build up in the blood vessels and kidneys. Myth 3. Vitamin K2 is in most foods. In fact, its content in common foods is limited, and many people are deficient in this vitamin. Conclusion. An investment in health. Vitamins D3 and K2 are essential components for good health. Their synergy provides bone strength, protection against heart disease, and maintenance of overall health. It is important to remember that a deficiency of these vitamins can lead to serious consequences, including osteoporosis and cardiovascular disease. Therefore, including them in your diet, especially in supplement form, is a great way to take care of your health and prevent many problems in the future. If you want to learn more about vitamins and how they affect your health, subscribe to our channel and stay tuned for more helpful tips.